morning, one and all present here. Today we are going to discuss a theory topic related to quality control. This is one of the important major topic in oral radiology. Let's proceed. Yes. So what do you mean by quality control and quality assurance? Quality assurance means it's defined as any planned activity to ensure that a dental office will consistently produce high quality images with minimum exposure to patient and personnel. So according to White and Farrow, this is a definition of quality assurance, that we are providing a quality that means high quality images, but with a minimal exposure to the patient. So what do you mean by quality control? So that is the specific measure for ensuring and verifying the quality of the radiograph taken. So we have to recheck, we have to verify whether the images taken was in a good quality. That is called quality control. So that is the difference you should know between the assurance and quality. What are the aims of this quality assurance? To produce consistently high standard radiographs, to reduce retake of the films, to determine the source of the error, and increase efficiency of the films and the images, and reduce cost, obviously. Then reduction of radiation dose. So these are the steps we have to give importance or consideration in quality assurance procedures. The four scenarios we have to give importance. That is first thing is daily task, then weekly task, and monthly task, and yearly task. So what do you mean by daily task? So daily we have to check the processing solutions, because we can check the processing solution by comparing the radiographs with the reference film or with the step wedge technique. I'll explain what is step wedge, everything in the upcoming slides. And the another step is enter causes or retakes in a logbook. So if we are having a proper logbook entry, that how many retakes we are doing, that is important for the daily task thing. Then replenishing the processing solutions. So we have to replenish the solutions, even developer and fix the solution daily, or we don't need to change the entire solution, but at least we can replenish the developer and fixer to get the proper density and contrast. Okay. The final one in our daily task is check temperature for the processing solution. What about the weekly tasks? So replace the processing solution after a number of X-rays processed has been done. We can replace the entire solution from the tank. Then clean the processing equipment and clean the view boxes to check whether dirts or scratches are there. Okay, so review retake log. Whatever the log entry we have we are tracking in the logbook, we have to review the retake log. Then monthly task, we have to check the darkroom, safe lighting, so that the proper contrast images, density images that we are acquiring from the processing. Then clean the intensifying screens, rotate the film stock, so that we can ensure whether we are using the old expired films or the new films. Okay. Then check exposure charts. Then last one is inspect leaded aprons and thyroid collars. The yearly task is the major thing. We have to do the AMC for the machine and calibrate the X-ray machine properly in a yearly task. Okay. So let's see one by one this quality steps. First thing is compare the radiograph with the reference films. Obviously, we have to check with the density, check the proper density and contrast of the image with our reference film. Okay, so that the proper contrast and density should be there in the reference film. So every time we can, after processing the each film, we can compare with the reference film so that it matches with the original density and contrast. So that can be done with your daily task, because the image with optimal density and contrast serve as the gold standard or reference film the following days or weeks. And one more thing we can do is a step wedge. What do you mean by step wedge? We can take the lead sheets from the old films, exposed films. Okay. we can stack the 5 lead sheets together and staple at one end, so that we are creating a wedge of lead 5 sheets. The top layer, we can cut the 4/5 of the sheet, then the third layer, second layer, first layer. So we are creating a lead sheet stack with the top end of the wedge. So if we are after creating this wedge, you have to process that thing and expose to that and process that. The resultant image should show the 5 steps from dark to light. So after creating this lead wedge, keeping on the film and exposed to that, and getting the film processed to film with this 5 steps of lead wedges with a different density from the top layer to the bottom layer, because we are keeping one layer one by one as a step. Okay. So the most accurate and rigorous method of testing film processing solution is use a sensitometer and densitometer. So one sensitometer exposes the film to the calibrated light pattern. After processing the film, densitometer is used to measure the optical density of the each step. Okay. So change in the density reading, the density from the top layer to the bottom layer, we can see the changes in the density from day to day. It indicates a problem in the darkroom. Hope you all understood, because this kind of wedge step technique definitely helps to assess the density ranges from the top to the bottom layer. Okay. So enter finding in the retake log. So as I said, we can maintain the log records with the proper retake, how many retakes are doing per day. That is important step for assessing this quality assurance, because we have to give a quality radiographs with the minimal exposure. So we have to keep tracking on the retake entry. Okay. Replenish the processing solution also. Do that if it is necessary, because we can assess with the solutions over a day or a weekly entry. The processing solution must be replenished if it is necessary. According to our step wedge technique also, we can compare with the density from top to bottom. Check temperature of processing solution. 20 degrees centigrade for manual processing and 28 degrees for automatic processes. Then we move on to weekly task. So we can do this replacing solution. In daily basis, we are replenishing the solution based upon the number of X-rays we are processing. But here weekly, we can definitely replace the processing solution. And the frequency of replacing solution depends on the rate of the usage and the size of the tank, and whether the cover is used properly, and the temperature of the solution also decides this replacing thing. Next is clean the processing equipment. We need to make sure that whether the equipments are clear and dirt free and rust free. Okay, the rollers of the automatic film processor should be cleaned weekly once according to the instructions. So thereby it prevents the cleaner from interfering with the actions of the film processing solutions. Then next thing is clean view boxes. So we have to make sure the view boxes are clear without any defects or particles or dust or that may interfere with the film interpretations. Okay, we might thought it's an artifact or something, but it could be a dust from defects from your V box also. Review retake log. We need to keep tracking on your log entries. Monthly task, you should check the darkroom safe lighting. As we all know, a darkroom is having a proper GBX2 safe light, so that once you open the film, you should not enter the straight white lights. So we should make sure safe light is working proper in condition. Okay, so film becomes fogged because of this inappropriate use of the safe light filters, and excessive exposure to safe lights also, it's very dangerous for the films. So we have to check this safe lights. One of the checking test for the safe light is the penny test or coin test. So after exposing the film, once you enter into the dark room, once you expose the film, remove the film from the packet and place a coin over the center of the film. Generally, the safe lights, okay, filtered safe lights with the GBX2, they are having minimum 5 to 8 minutes of the safe light capacity. If you are keeping the coin over the exposed film and you are waiting for 5 minutes, after 5 minutes or before 5 minutes itself, if you are able to see the image of the coin after processing the film, then GBX2 filter is not safe. Okay, that means safe lights are exposing the regular white light to the film so that you are getting the margins of the coin. So penny test definitely helps you to identify the safety of the filters, safe light filters. The other safe light test also, a box of panoramic or subfluorescent films will be placed on the counter of the top under the safe light. Once film is removed from the box, which is then closed, then the operator should pull out the approximately 1 inch of the film every minute. So we are taking the OPG film 1 inch for every 5 minutes. After 5 to 8 minutes, a line of darker density will be seen for every minute. If we are changing, if you are able to see the changes in the darker density, then you have to consider this safe light filters changing or check about the filters. Okay, most of the GBX2 safe light filters are designed for the use with the panoramic or sub films. These are 5 to 8 minutes safety at a distance of less than 4 feet. And clean intensifying screens also. The presence of scratches or debris results in recurring light areas of the resultant image. The foam supporting the screens in the OPG cassettes must be intact and it capable of holding both the screens closely against the film. If the close contact is not maintained within that OPG cassette, the image might lose the sharpness. So we should make sure about the supporting foams and close contact of the film to the intensifying screens. And rotate the film stocks definitely, because if you are receiving the new films, the old film should not be accumulated in the storage. You should rotate the films according to your usage. And check the exposure charts also, because we are maintaining a fixed MA and KVP also fixed up to 70 KVP. Exposure time also is varied according to the patient, for the pedo patient and adult patient, old patient, so that we have to maintain the proper exposure charts. And one more thing is check leaded aprons and collars also. We should not keep this leaded aprons folded because cracking of the lid might happen if you're folding and keeping in the cupboards. So better you can hang the apron from the hook, okay, or else in the handrails. Then the final yearly task. This is very important because we have to calibrate the X-ray machine based upon the proper MA circuit and proper KVP settings. It's very, very important because set the X-ray machine at a standard set of exposures and measure the radiation output with the dosimeter so that we can compare this kind of exposure in the particular fixed way. Okay, so any discrepancy means we have to check the timer also and MA circuit also. Because timer is we keeping the impulse based timer setup, because 60 impulses counts as a 1 second. We can check whether the rotating timer is self-rectified dental X-rays are having a proper MA setup and timer setup. So we should check with the spinning top test. Okay, so you are keeping the film on the tabletop and you can rotate the spinning top over the film. So you are allowed to expose that X-ray via the spinning top. So it has some hole over that top area. Okay. So according to that timer, it gives impulses on the film. So if machine is set up to 15 impulses, means the 15 dots also should be seen on the X-ray films after we are processing the film. Okay, so that it is giving exactly 15 impulses on the particular second. Okay, once we are moving the spinning top to the other area of the film, again you should see the 15 impulses on the particular timer. Okay, 15 dots you can able to appreciate after the processing the film. So that checks your the timer setup. And check the linearity of the MA control also, because some of the machine might have with the two or more MA settings. So first you should check with a regular setup MA, then go on to the reduce MA or higher the MA setup with another exposure time. The dose at each exposure should be the same. Okay, dosage should be the same. If discrepancy implies between the each dosage, means that the fault should be there in the timer. We should compare with the MA control with the linearity with the timing setup also. And check the quality of the X-ray beam is totally based upon your KVP settings. Okay, so the factors controlling quality of the image might be the accuracy of the KVP setting, it's 70 KVP or 72 KVP, and also the focal spot size. That determines your quality of the X-ray beam. That means sharpness of the image. So the KVP setting, here we can check the penetrating power of the beam. So this totally relies upon the half value layer, because half value layer principle states that 50% of the X-ray photon should penetrate through a standard thickness of a given material. Okay, depending upon KVP only. If you are using 69 KVP or less than 69, 50% of the X-ray output must pass through the at least 1.5 mm of the aluminum layer. If you are using 70 kVp or above 70 kVp, then it must pass through the at least 2.5 mm of the aluminum filtration layer, so that we will get a proper sharp qualified quality image. Okay, so this entire half value layer specification is completely relied upon the thickness of the aluminum filtration what we are using in our machine. And another test is definitely this focal spot test. Okay, the surface of the focal spot becomes pitted over the time and enlarges. So enlarged focal spot, it decreases the sharpness and increases the magnification. Small focal spot provides a sharpness that is measured by the resolution. So focal spot size is fixed with the machine. It's the default machine setup. So you must be knowing a difference between the normal focal spot or effective focal spot. We are having 1 mm focal spot, effective focal spot, that the small size provides sharpness in the image. So we can check this line pairs also. How many line pairs are there to check the focal spot size. Okay, it's a relatively simple and inexpensive method. We are keeping the 6-inch cylinder. Okay, the open end of the cylinder is centered on a piece of the occlusal film. An exposure is made by placing the end of the position indicating device against the closed end of the cylinder. So excellent resolution means we'll definitely get 11 to 12 line pairs. Poor resolution means you'll get only 7 or less line pairs. Here you can appreciate the line pairs. Okay, so 11 to 12 means focal spot is giving as an effective. This is the focal spot test tool image. So here is the pinhole test. The X-rays is passing through the small focal spot. Checking the collimation of the X-ray beam is also another one of the important yearly task, yearly calibration. Okay, so according to the federal standards, the beam of the radiation must be collimated to 2.75 inches at the tip of the BAD. Any machine failing to comply is considered illegal. Okay. So collimation test, we can do either exposing a rare earth fluorescent screen on a loaded panoramic cassette, or we can do one more test. We can keep 4 IOPA films at this on a piece of paper in the form of a cross-shaped template, and we are exposing the film on the center of that cross-sections template. If the exposed area is greater than 2.75 inches in diameter, then the lead collimator opening is too large. We have to change according to the diameter of the exposing area. It should be up to the 2.75 inches. Other yearly tasks include like a tube head stability is one of the major factor, because the tube head should be very much stable when placed around the patient's head, and it should not drift during the exposure. So we should be very much cautious about this all daily task, monthly task, yearly tasks. Okay, weekly task also. So all these four kind of tasks that will help in getting a proper quality images. So these are the quality assurance steps we are considering before starting the day of your radiology posting. Okay, and thank you so much for listening this entire presentation. We'll see with another wonderful lecture. Thank you. Thank you so much.